My name is Dr. Heather Strah. I am the Medical Director of Lung Transplantation at Nebraska Medicine. As you all know, Nebraska Medicine is home to one of the most distinguished and well-known organ transplant programs in the country. Our first transplant was in 1970, and our team is nationally and internationally renowned. Our specialists have performed thousands of heart, liver, kidney, pancreas, and intestinal transplants. After years of planning and preparation, I'm happy to announce that we are launching a comprehensive lung transplant program. The addition makes Nebraska Medicine one of the few institutions nationwide to offer all solid organ transplants under one roof. Patients will no longer need to travel hundreds or thousands of miles for treatments of end-stage lung disease. Our team of treatment specialists will provide patients support from pre-transplant evaluation to long-term follow-up treatment. We will also assume the care of appropriate patients who've received lung transplants elsewhere and live locally. Patients can expect to receive compassionate, collaborative, world-class care close to home from all of the members of our transplant team. One of our specialists is here with me today, Dr. Aleem Sadiq. He is the surgical director of our lung transplant program, and he will speak about our goals for the first year. Dr. Sadiq.
Thanks, Dr. Strah, and thank you for coming. Just to reiterate, a lung transplant program requires a large group of people who are all pulling in the same direction, and this program is the product of, well, really many years of work by many excellent providers, and we're pleased that we're finally able to get it off the ground and able to serve the people of Nebraska as well as the surrounding states. Our lung transplant program will offer single lungs, double lung transplant, and also heart lung transplant. We're hoping that in the first year we'll see 20 to 30 patients and perhaps perform 10 or so lung transplants, but of course that's very unpredictable given the unpredictable nature of transplant itself. Besides that, we also feel strongly about education, research, innovation, and one of the things that I think I can safely say we all feel very strongly about is organ donation. Nationally, there's about 120,000 people who are listed for organ transplants, and approximately 18 to 20 of people are estimated to die every day because they're unable to receive an organ in time. So there's a real a real difference between the number of people who require organs and the number of donors available. A single donor can save up to 8 lives, and organ donation after the love of a lost one is an opportunity to honor that individual during a time of otherwise great sorrow. So without further ado, I'd like to introduce Caitlin Strom, who knows this firsthand. She lost her mother on March 29th to a brain aneurysm. Her mother is Kathy. She was a surgical tech who worked at several hospitals in the area, including Nebraska Medicine at Bellevue, and we're really glad that Caitlin joins us today to share with us some of her mother's story.
Thank you. On March 29th of this year, my life was forever changed. That was the day I lost my mom, my support system, and my best friend. My mother was the most caring, loving, selfless person I've ever known. She spent her entire life putting her own needs second to her 5 children that she raised single-handedly. She devoted every ounce of her being into loving her children and providing us with the best possible life that she could. She was an incredibly hard worker. Not only did she raise her children with no help, she spent her days at work helping others as well. She'd worked in surgery for the better part of 30 years. She was employed as a surgical technologist at Women's Methodist Hospital at the time of her passing. It was because of her loving nature and her constant want to help others that she worked in the field that she did. Organ donation isn't really something that my mom and I talked about often. The few times that we did talk about it were when I was becoming of age to drive, and I wasn't really familiar with organ donation in itself. I questioned whether or not organ donation was right for me. I was young and honestly didn't know anything about it. Without skipping a beat, my mother told me that she was an organ donor. That's all the convincing I needed. If it was important to my mom, it was important to me. She saw firsthand the lives that could be saved and were being saved by organ donation. I guess it never really came as a shock to me knowing that she was an organ donor. She strived to help others in any way that she possibly could. She once made the comment that she wouldn't need her organs after she was gone, so it would be a gift to others if she was able to do that. And why keep the quality of life from somebody else? I always knew that my mom's life would make an impact on others after death. I just never knew to what extent. I didn't know that our tragedy would be somebody else's miracle. Knowing that a piece of her has given life to a family that may have lost all hope helps me and my family cope with the loss. Even in death, her legacy lives on. She not only lives on in my memory and heart, but now in the lives of complete strangers as well. She is truly an angel that saved lives not only in her time on earth, but also in her passing.
Thank you, Caitlin. Donate Life Nebraska is also here today. They have a table set up in the back, and if anybody would like to ask them about organ donation, they'd be happy to answer. And we're open for questions now.
When did you notice approved of the program?
I believe we received the notification that the program could open in late October.
Any date set for when a first surgery would be or could be performed?
So unfortunately, it's a very unpredictable sort of situation, just inherently because we're reliant upon deceased donors in order to do transplants, and of course we cannot predict when a suitable donor would be available. So it could be any time from today to months. The average time that a patient waits across the nation for a lung transplant would be about 4 months. But of course, there are some who wait less, and then there are some who wait longer. And unfortunately, there are some who will not receive a donation.
Besides the obvious element of patient care, what other benefits does Nebraska Medicine derive from a robust transplant program?
Well, I think one of the most important things that we as a transplant facility can offer, it doesn't necessarily benefit us as an organization, but nationally and internationally in medicine, that we're able to offer opportunities for research and to generate and spread new knowledge related to how organs function both in the healthy state and how organs function when they become diseased. That's one of our most important goals as part of this transplant program, other than to improve the lives of people living in the state of Nebraska, is to also generate new knowledge and able to contribute scientifically to the field.
Does that help recruit scientists?
Absolutely. The having a transplant program at this institution and having all solid organs available under one roof helps to recruit scientists who are interested in a variety of things, not just in lung disease, but also in microbiology and in genetics. It's really a wonderful opportunity.
Any idea how many people in Nebraska are waiting for a lung transplant?
So that's a great question. We couldn't tell you exactly. What we could tell you is that within the last 6 months, would you say, there have been approximately how many people we've referred?
So in about the past year, I know that the institution, so just Nebraska Medicine, has referred at least 6 people outside of the state of Nebraska. And then we are constantly receiving calls from physicians in the state of Nebraska wanting to know if lung transplantation is an option here and how would they be able to get their patients seen and evaluated. The demand is, or I shouldn't say the demand, the need is great.
How far have people been traveling for this kind of transplant?
In the past month, I have seen a patient who was transplanted at Duke University in North Carolina, someone who was transplanted at Stanford in California, and our pulmonologists here follow people who have been transplanted in Cleveland, in Pittsburgh, in Minneapolis, out in Colorado. People travel all over the country to find the right transplanting institution for them. And those people now have the opportunity to be evaluated here and potentially transplanted close to home where their family is available to support them.
What factors make Nebraska Medicine a good place for a transplant program?
So I think if we're talking specifically about lung transplant, then we've got personnel from many other institutions around the world with experience in lung transplantation, and I think there's also a real benefit to being a part of a program or part of an institution that also offers other solid organ transplantation, because there is some knowledge that we get from other solid organ transplant programs and what they do and what works for them, etc. And then I would say that just globally for the institution, it's the fact that we're able to offer all the solid organ transplants is something that's very fairly unique and very beneficial for the institution, again, because it allows for all sorts of collaboration and potentially even allows for multi-organ transplant and other things that are pretty unique and difficult to find that sort of expertise in one place. Is that
There's no other questions? Guys?
Thank you.